thank you, everybody. And I will now hand over to my colleagues from HISP Rwanda for the Central African Republic use case. Thank you very much.
Okay, thank you so much, Stefano. So I'll go ahead and share my my slide deck, and just to let you know that I will be collaborating with my colleagues here. There is Jean-Paul Mutali, and with whom I will be presenting the presentation, and also there's my colleagues on the webinar. There's Amza and Derek. So we collaborated on this presentation. Also the microplan implementation in the Central African Republic. So they will be assisting mostly after the presentation in taking questions and so on and so forth. So so our use case in Central African Republic focuses on the introduction of WorldPop in helping in data in the decision making. So I will let my colleague Mutari first introduce the situation, and I will come with how we were able to do it.
Good afternoon, good morning, everyone. My name is Jean-Paul Mutali. I'm from HISP Rwanda. I lead the digital infrastructure and systems integration. On the use case of Central African Republic, implementing microplanning for vaccination. So the main challenge for this country is, the first thing is a huge country. It's the size of France and Spain combined, but the population is around 5 million. But with the wrong time with the war, there has been no census. The last census was 2003, so it's very old. The recent one, the results are not yet published. So it's hard to plan because there is very remote areas where the health facility serves. There is a long distance. The roads and the infrastructure in general are not good. And there are still some parts of the country where there's still insecurity. You can find refugee camps and people moving between region. So that leads to outdated demographic data at facility level or even at the village level. So the planning for microplanning was done mainly with a spreadsheet, and it was hard to combine or to have a general picture, and also it's very hard to reuse. So you could miss the whole community because this paper, maybe one spreadsheet is missing or it's not, they moved during this exercise. And we know that to have a good plan, you need to know how many people exactly and where they live, so that you can provide the vaccine and also dispatch teams which will be administrating those vaccines. Next. So to respond to that challenge of outdated population data, we used a WorldPop in DHIS2 because this one is provide a good resolution, 100-meter resolution gridded data, which is enough to see all the settlement, all the refugee camps, and at the lowest level possible, not just district or region, but within even a health center or a health facility, you can see how many people this facility serves. The other second reason is these are at least updated data. They are released annually, so we can see the progress or the movement of people or in the whole country. The third, this one is come from satellite imagery, and the WorldPop team models that to have it spread in the whole country, so that we can have at least the total population in all administrative or health catchment area where the normal data is missing or uncertain, or there are errors. So next to have this WorldPop data into DHIS2, we have had we are now on the third iteration of our application for microplanning. First, we started with like, if I can call it, a very simple setup where we have the normal DHIS2, and then we load in the WorldPop data, and we use QGIS, the external application for maps to generate the high resolution maps. But that one was limited in functionality, and also it required district or health facility staff to have some knowledge about GIS, which is a bit complicated. So we moved to now using crosscut. I think they will have also some time here during this session to present how it works, but we mainly use to generate the catchment area for health facilities. This was very helpful. And also we added another custom application for other tasks for microplanning, especially for cold chain estimates, and also generating other report or other tools for teams to know how, for example, how much money will be needed by health facility, which type of transport will be needed, and also to estimate or to show where there is insecurity, where there is infrastructure needed for the vaccine deployment. Currently, we are at the third iteration of the application, which my colleague Maurice will dive in detail, which is now is like one application which does all the workflow for the microplanning, starting by including the WorldPop, defining the catchment area, and then capturing or putting together all the indicators needed for the microplanning. And this generates a microplan for health facility, for district, for province, and for national level team, for everyone to have what they need to do or what action needed for on their side, and later monitoring. So I pass my colleague Morris to go to dive into this application. Thank you.
Thank you, Motari, for a great presentation. And I would like to be quick because it looks like we have 11 more slides remaining with less time. So as Mutali said, we came up with a microplan app, which is an improved version from the other one, the other iterations. So how it currently works, we load the world population using the GeoTIFF format, and after loading the population, we partition it because most of the time it's too large. We partition the population to the chosen unit level. For instance, when we want to analyze the district, can partition to the district level using the DHIS2 units. So after loading the population, we can easily see the population where they live, and with different colors and settlement dots. So like this, the users who can be able to plan the micro plan, the coverage, for instance, the cold chain coverage, where they need to send the materials for cold chain and see the existing sites with the status of their cold chains. So after that, we actually do not rely on one single source of data. We can compare with the actual data DHIS2 users inserted, and see what the insights we can get from there. So this is the screen. It's a custom view we built. We just go to HDS WorldPop Data and search for a particular country. For our case, we were using the Central African Republic, and after that, we can choose the partition level and choose the type of data and also the resolution. Is it 100 or 1,000 or 1 kilometer? So after doing this, we can create different types of components depending on what they want. The most important component is a component that shows a comparison between the population data inserted into DHIS2 and the population data from the WorldPop. For instance, here it can reveal that there's some missing data, but WorldPop data, you can see that they exist in one district, in one catchment area called Birao. You can see they did not insert population data, but we can see there is data from WorldPop. So this helps split a district into a realistic workload zone for vaccination team, and of course turns what we used to have as a population total into a picture where the district staff can reason and plan for. So we have another example of if you look back, this is the catchment area without which was missing population from DHIS2. So on the next slide, we are looking at we are zooming in on that particular region or catchment area and see what's going on there. So we can see different strategies in the middle. The fixed strategy, advanced, and mobile outside of the red circle. We can see that there's a lot of people that are not covered by the strategies, and this helps us to know which community fall outside of the coverage circle. First of all, now the district teams can own their microplan. At the end of the day, those components I was showing you, they can download them and use them offline. And also we realized that we can treat the WorldPop as a second option, and it's not always the ground truth. We can always reconcile, compare between the actual data in DHIS2. So next step, we roll out into across more districts, and as I said, we will wire the WorldPop data into the cold chain decision making tool. So quickly, we'd like to give thanks to the partners, Ministry of Health, Central African Republic, Gates Foundation, Gavi, IMC, DHIS2, of course. And we thank you so much for your attention.